Hello, and welcome back to another episode of the Vision of Being podcast. Today, I'm really excited to talk to you about some things that I've been marinating on, researching, and really feeling into for the past few years. And these things are my decision on why I'm choosing a wild pregnancy, and I'll get into what that means, to have a home birth, and to homeschool my children. And while I don't have any children yet, I think that these are really important topics to start thinking about before you even have kids. Because what I've seen start to happen is that people become pregnant, they go to their doctor, their Western doctor, wanting all of the answers, all of the information, and that's really when they start their path of research and figuring out how they want to give birth and how they want to raise their children. And the problem with this is that when we're going to a doctor, we are then outsourcing pretty much all of our decisions. And there's a lot of things that are happening in the medicalized birthing industry that are really away from nature, our natural way of birthing and being. And they're causing a lot of negative outcomes. There's really a huge problem in the birthing industry today that we've now made it so medicalized with so much equipment and procedures and interventions that we're actually starting to get really negative outcomes. It's pretty wild to think that the C-section rate is about 30%. And just let that marinate for a moment. 30%, you are having your womb, having major abdominal surgery happening, being cut into, and this has super negative repercussions, not just on yourself, but also on your baby. When you do have a C-section, your baby isn't getting the bacteria that would be coming from your vagina. And there's a lot of different negative consequences that come from C-sections. And C-sections are absolutely life-saving. And I'm so thankful that in a true medical emergency, we have this as an option. But C-sections, induction, all of these new medical interventions are having negative outcomes on us, on the birth, on the birthing mother, on the birth of the baby, on that baby's birth experience, which when we think about it, this very first entrance into the world is huge. This affects how you're going to show up in the world. Like, were you taken away from your mother right at birth to have procedures done, to be weighed? Were you really handled around by a lot of different people? And they say that this hour after birth is so crucial for bonding. And you can imagine that you're literally being plopped into this brand new world. And if that's not a smooth and cohesive experience, that could easily rupture and create trauma for the rest of your life. So the way that we birth and returning back to our natural roots in birthing is extremely important. And this is shaping how people show up today. This is shaping our society of the levels of either love or anger or disconnect or connection that are in society as a whole today. So I'd like to start by talking about my decision for a wild pregnancy. And what a wild pregnancy is a pregnancy where you don't go to the doctor. And while this might sound crazy, people didn't go to doctors when they became pregnant until like a few hundred years ago. We didn't even have any of this medical equipment until like the last 100 years, such as sonograms and all these different blood tests. And when you think about it, we've been birthing as mammals and as humans for thousands and thousands, tens of thousands, millions of years as mammals. And we've been doing it and we've been surviving. And this goes to show at the flourishing amount of life on our planet. And the fact that you and me are even here right now has to do with our body's innate wisdom to birth. Otherwise, these millions and billions of creatures on this planet wouldn't exist right now. And so this whole birth process has been being refined for literally eons. As far back as time goes, we've been birthing, and we've been birthing successfully, because if we didn't, we would die out. And so, yeah, I've decided to have a wild pregnancy where I will not be going into the doctor. I will not be getting sonograms. And the thing with sonograms is that there's been some research where we don't exactly know how safe they are. And a lot of different people in the medical industry will tell you they're perfectly safe, yes, but we don't know this 100%. Like, there's a reason why when you get an x-ray, they put the pads over your body where you're not being x-rayed, and they really want to limit the amount that you're being x-rayed, because we know that sending these waves, these vibrations into your body isn't a good thing. And that's why the doctors leave the room. We innately know that this kind of creeping to look into our insides has some repercussions. And I don't want to take that chance on my growing fetus when your life form is literally at its most vulnerable, at a tiny little fetus or an embryo. And I don't think that even if something did show up on the sonogram for me, that there was a birth defect or the like, that I would have an abortion. I did have an abortion. That's in a different video. And yeah, even if my baby had an extra arm or something of the like, I would just take that as part of God's plan and continue on anyways. And another reason that I don't want to have these medical procedures done, drawing blood, doing this, doing that, is that there's a waiting period, right? Like when you get a sonogram, when you get a blood test done, when you have any of these medicalized procedures done, you're waiting. And you're in fear when you're waiting. You're thinking, is my nutrition okay? Is the baby okay? Do I need to be worried about something? I mean, God, what is this test looking for? And you really kind of take the trust out of yourself and out of your baby, that trust that you really start to build with your baby, that connection and the psychic connection between you and your unborn child of, are you okay? What do you need? I trust you. I trust that you're growing according to plan. I'm giving you my trust. I'm not outsourcing this trust to a doctor who, yes, they went to medical school. Yes, they know so much, but they don't know everything, and they don't know your body. And I don't want to live my pregnancy in fear of knowing, oh, I have an appointment next week for this, to check for this abnormality. So now I'm going to worry this whole week, and then I'm going to worry for the 2 weeks after until we get that testing back. I want to live in a space of trust and knowing with me and my baby, not outsourcing this sense of safety into somebody else when really they can't always tell you what's going on anyways. At the end of the day, it's going to be a surprise if your baby comes out fully formed and healthy or not. And there's no test that can set you up for every single possible outcome that's going to happen. So that is pretty much in a nutshell why I'm deciding to do a wild pregnancy. I just want to come back into this space of full trust, full surrender. And it would be a different thing if you had pre-existing medical conditions. So that's when modern medicine comes really amazingly in handy. If you had some condition that's putting you or your baby at high risk, of course, in those scenarios, you would want to do the blood test and the sonograms and everything like that, because that's what these medical options are there for in case of medical necessity. But birth is a beautiful, natural thing that we've been doing forever and ever. And so I just want to bring back that trust into my own body. And from before my baby's even born, allowing them to know that I trust them, that I trust my baby, that I'm giving them this power to trust themselves even. I'm not even telling them from that space in the womb that we need to outsource our decisions to other people. And so even they're learning this lesson even in the womb to cultivate their own power, to trust themselves, and to really cultivate that confidence of knowing in their own decisions. So on an energetic standpoint, I'm really bringing this trust of the universe and this innately human natural process back into myself and also back into my baby. And so it kind of ties into why I'm going to do a home birth. And I want minimal people around. So there's so many things that are happening in hospitals that are extremely backwards and do not go with natural birth at all. First and foremost, usually when you think of a dog, a cat, any kind of animal that's giving birth, they go and find a nice dark place. They go into a closet. They go underneath a bed. So it's very natural for us to want to kind of like go into a little nest to birth, somewhere dark, somewhere safe, somewhere where other people aren't around, so that we can really be in the process. And what happens when you go to a hospital? You're in bright lights, there's noises, there's monitors going off, and this is a deeply unconducive environment to being relaxed and to being able to let go. Because to have your cervix dilate and to have your cervix open, you have to be in a relaxed and safe environment. And there's been some studies that when a doctor walks into the room, that the cervix slightly closes, especially if they don't feel trust with the doctor or something like that. And so our bodies aren't just these linear things, robots that just open a certain amount every hour without any type of influence from the outside. Our bodies have a lot of wisdom. Like, you can go from being dilated, having your cervix open, say 7 centimeters, you could be far along. And if something were to happen, like someone that you really didn't trust were to walk into the room, or there was a startle or a scare, your cervix can literally close back up. And this is made for us to help us, in the natural environment. If we were giving birth and then a predator came up or something like that, this would help us to literally stop giving birth and to, save the giving birth for a time when we went back into safety. And so that's kind of one of the first main things, is that environmentally, our hospitals are not set up to make a cozy, safe environment. Another reason I don't want to give birth in the hospital, or personally, I don't even want my midwife to give me cervical exams. So if you're trying to relax, you're trying to open up your cervix and let this baby come down and really let everything happen naturally, having a person literally shoving gloved fingers up, because that's how they check your cervix. They have to go look up all the way to your cervix and see exactly how open you are. And I know for me, at least, having somebody check my cervix multiple times while I'm trying to get into this space of relaxing and surrendering would just make me close up even more. Like, whether it was a man or a woman, a midwife that I really trusted, I feel like the only person that would not close me off going inside me would be the person that put the baby in me. And usually your partner isn't qualified to check your cervix. So with that said, I don't even want my cervix checked when I'm giving birth. I want to feel into my body, once again, not giving away this power, this sovereignty that we have over our bodies, and trusting that our body knows what it needs to birth a human. And that if we can tap into these feelings deep enough, we don't need these reassurances of it's time to push, it's not time to push. Nobody but your body knows when it's time to push. And so, it's so multifaceted. There's so many layers to this, which is why when I started studying birth a few years ago, when I started thinking like, I think I will want kids in the next few years, let me start studying this. The layers to birth and the birthing industry and everything that's happening is so deep and so multifaceted and has so many layers. This just became something I've read so many books on now, watched so many YouTube videos, podcasts, Instagram channels. It's been really addictive because there's so much that's actually going on within birthing. Another lie that we've been told as women is that we need an epidural. We've now been conditioned to think that we are not strong enough, that we can't handle the pain of birth, that we would die if we had to experience this pain. And while it is a great amount of intensity, I'm sure, there's something so empowering and beautiful and in preparation for motherhood that I believe that feeling all of the intense sensations and emotions that are coming up will give us. And that's just on a more spiritual side. If we're looking at epidurals from a more scientific standpoint, there's so many reasons to try your best not to have one. And that's because when you have an epidural, your body is now not releasing the same amount of hormones and oxytocin, which is the love bonding chemical, and all of this different really complex cocktail of endorphins and hormones that give you pain relief and help your baby move down the birth canal. And the one that's the most interesting to me is that we aren't releasing the same amount of oxytocin when we have an epidural. So oxytocin is what's released when you're breastfeeding, and this is what bonds you to your child and your child to you when the baby is born. And since we aren't feeling the sensations of birth, our body isn't releasing the same amount of oxytocin that it would have released had you been able to feel all the sensations and move along with the natural physiological process of birth. And so when you think about it, what this does, babies who are born under epidural, are groggier. If you think that you're putting something into your body that's numbing you from here to here where your baby is, and that your baby's not getting any of that, not true. And I've heard from experienced doulas who've seen thousands of births that there's a different nature to babies who come out with epidural versus who come out naturally, and that the babies who come out with the epidural are groggier, sleepier, they're less responsive. They could even start breathing a little bit later because they're sedated. The baby's literally coming out sedated. And this has a lot of different effects. So when a baby comes out sedated, they aren't latching on as well. So this can create breastfeeding issues. You could literally not have as easy or good of a breastfeeding journey with your child because they aren't latching on from that moment. And not to say that they couldn't develop the skills later, but this is a very real implication that you're not releasing that amount of oxytocin, your baby's groggy, and you're not going to have the same breastfeeding experience if you have an epidural. Also, just the implications of not releasing the same amount of oxytocin. You are literally not bonding with your baby as much if you're not releasing that amount of oxytocin. And I don't mean to say that you don't love your baby any less, but as far as this human hormonal chemical cocktail goes, you're not getting the same level of oxytocin that you would if you had a natural birth. And so when we think about the implications that this has on society, that literally from birth, we have a whole generation, or now a few generations of people that are not getting the correct amount of bonding hormone with their mother. Like, what implications is that having on society as a whole when mother and baby are actually not bonding as much as they have in times past? And what kind of world is that creating? What is the ripple effect of not releasing this love cocktail when your baby is born? Really interesting to think about the far rippling consequences that this could have. Also, one more note on epidurals. With the epidural, sometimes this can make labor last a lot longer because you can't feel what's happening. So you don't know when to push your baby down. Like you can't feel the urges to push as much. And so sometimes the baby can get stuck in the canal because you're not having those natural impulses to push. What happens when the baby gets stuck in the canal? Now the baby is in distress because it's not coming out at its natural rate. The heart rate can start to drop. And this is usually when C-sections are starting to occur now. The baby seems in a lot of distress. The baby's not coming out fast enough. And so then we move to emergency C-section, which I already spoke on some of the consequences that having a C-section has. And so, yeah, while we're on that, we'll just jump right to induction. I'm telling you, this is insanely so many different perspectives in the birth industry and so much to learn about. So induction is now being planned cesareans, planned inductions, where they give you Pitocin, which is a drug that helps to open the cervix and move birth and start the process of birth. It's artificial oxytocin, which starts birth. So they give you Pitocin, and actually being induced is a really long process. It's not just like you take the Pitocin and then you start to go into labor. It's actually a super long process. You have to leave the hospital for a day after you take the Pitocin, see if it comes on. You have to have IVs hooked up to you. Oh, which is another reason why I personally don't want to birth in a hospital. While you do not have to have an IV hooked up to you in a hospital, please remember that if you do choose to birth in a hospital, you do not have to have an IV. All of these things that are pushed on you, you can say no to. So you can create whatever birth you want, even if you do decide that you want to be in the safety of a hospital. You do not have to have an IV, because what happens when you have an IV? You can't get up, you can't walk around, move around. It's much more difficult. And as we're giving birth, really changing birthing positions every 20 to 30 minutes is ideal, because as your body is naturally moving and changing positions, you're helping that baby to naturally move down the birth canal. And your body knows what positions it wants to move into for the different phases of labor and moving into birth. And so being in a still on your back position is not helpful at all in naturally birthing your baby and getting your baby down in a normal and timely manner. And yeah, it's just so many things to think about. It's so crazy. There's so many other reasons for not being induced. Our due dates really vary. There's a month where you could be born a couple weeks before, you could be born a few weeks after. It's just an estimation. And as we can see in growing children, people grow at different rates. People have growth spurts at different rates. Once again, we are not linear robots. We're human beings where our growth ebbs and flows, and not everybody's the same. And there's so many critical points that develop right before birth. So one of the last things to develop is our lungs and our breathing. And so when we induce, say that baby wasn't going to be born for another 2 weeks, very normal that this is happening. And so you can imagine, especially towards the end of pregnancy when things are really exponentially picking up, you can imagine what 2 weeks inside of the womb would do for your baby and their lungs. And it's even shown that when babies are born from induction, they have a harder time breathing. Rates of going into the NICU are higher because of this. And there's a lot of other processes that happen right before birth, right before natural birth. For instance, in just the very few days leading up to birth, the baby starts to get its sucking instinct. They've figured this out. I don't know how. Science is crazy. But they figured out that they get their sucking instinct only a few days before they're born. So this is literally one of the last things that develops. So if you're doing an induction and really you weren't going to naturally go into labor even a week, then your baby is not developing that sucking instinct and could have a harder time feeding. There's so many reasons that we birth when we birth, and that we birth at different times, and that there's not just this one due date that we can predict that's going to be best for everybody. You know, babies are still developing in the womb, and while yes, these babies can develop these skills or organs or breathing capacity once they get out of the womb, it's a much faster growth and process inside the womb, as you can imagine. It's like the difference between healing in this like little cocoon when you're sleeping and taken care of versus being out in kind of a crazy, chaotic world where you're waking up and going back to sleep and feeding and you're crying now and life is hard, right? Like you're not going to develop quite as fast or as well. Like you would probably have delayed growth. And so, yeah, induction is also such a lie. We do not need to be induced. And doctors are inducing people for a lot of different reasons. Once again, there's a few medical reasons why you would be induced, like real legitimate reasons. But there's a lot of really benign reasons why doctors are inducing now. Things like, are holidays coming up? It's wild. If you look at the birth and induction, like there's like charts of like when babies were born, there is significant dips right around the holidays, right around Christmas and Thanksgiving. On those days in particular, they make sure to schedule their inductions for anybody kind of like hovering around that window for before. And I'm not saying that this is in every single case, but there's a lot going on with induction that's just for the ease of the doctor, to make it predictable, to make it easier on the hospital system. But really, this is damaging our babies and damaging the health of our families and society. Yeah, it's so many layers. One last thing, and then I'll move on to why I'm going to choose to homeschool my children. So with a epidural, you're also much more likely to get an episiotomy. And if you don't know what an episiotomy is, that's when they cut the vagina towards the perineum so that this creates more space for the baby to come out. And this can have long-term effects. This takes a long time to heal. They can cut too deeply into the tissue of the perineum. It can make sex painful and really give you a weak pelvic floor, which is definitely not a good thing if we're trying to keep all of our organs up and inside and a strong pelvic floor. And so the reason that episiotomy happens more with epidural babies is because the incidence of using forceps and vacuum is higher in people who've had an epidural. And if you don't know what this is, maybe Google it. It's pretty terrifying to see what forceps are, which you can imagine them as like a big, like tongs, like medical metal, like these giant kind of scooped looking tongs. And so they will literally go up inside of you, which this is why they have to cut you so that they can fit these giant tongs inside of you, and grab onto the baby's head and literally pull the baby out of you. And so the baby will now come out with bruising all over their head because they were literally just ripped, pulled out of the birth canal. Or a vacuum is where, as you can imagine, that one's a little more straightforward. Literally vacuum, suction it to the top of the head, pull you out. And so, yeah, with epidural, since you can't feel your body, you can't feel if you're pushing or not, this happens a lot more commonly of cutting the vagina and pulling the baby out because you cannot feel what's going on. And of course, once again, disclaimer, there are times when this is necessary. There are times when this is life-saving for baby and mother. But a lot of what's going on today is due to epidural, being out of touch, and not having a natural physiological birth. So why I am choosing to homeschool my children is because, honestly, if the schooling industry was better, more effective, more personalized, more social, and actually taught relevant things for our life, then yes, I would love for my child to go into a normal school. But when we think about it, schools and the way that we know them with this very military-like system were actually born from the military. Like these type of regimented schools that we're in now were literally built and created to for people going into the military who needed to learn how to follow rules, follow the man, and just in that very rigid military-like context, which is why schools are the way that they are. Not to mention, on a deeper level, I really don't want my kids going to public school based on the environment that we are in today. I don't want my child in like the second grade to have to do an active shooter drill where they're drilling if somebody came in with a gun trying to kill them, what they would do. Would they go under the table? And then they're literally thinking that, like, how traumatic would that be as like an 8-year-old, a 6-year-old, to be having to practice a drill of perhaps getting shot down and watching your classmates get shot down. The fact and the rate of how much, especially in America, school shootings are happening, I think is more than enough reason to not want to have my kids in public education. And God bless, I totally realize that a lot of families can't either afford or have the time to homeschool their children or have tutors for their children. But this is why I'm thinking about this before I even have children, because this way I'm already setting my life up of how much money do I need to make? What will my life structure look like? How can I make this work? Because yes, I can see how when you're already in your job, your family structure is already set up, your finances are already set up, it'd be very, very hard to make that life switch, which is why I'm thinking about these things ahead of time, why I'm thinking about how I want my children to be raised in 10 years, how I want to birth, and all of these different things. Because if you start to think about these processes as they're happening, it's already too late. And so while I am in full acknowledgement that I have not had a child yet, I have not homeschooled yet, I do think that a lot of people listening and people in my community are in the same group as me, where we maybe haven't had kids yet or we have young children, and we're starting to think about these things. And we need to think about these things proactively because, like I said, it's a little bit too late, or it's at least a lot harder to make giant life shifts. So this is how I'm planning to set my life up in the future so that I have this plan in place and we can slowly move in the direction of that happening. Another reason why I don't want my kids going to public school, which I think I'll make a whole nother video about, is the ridiculousness of that children are being told that they can be their own gender. I think that it's deeply, deeply traumatizing and damaging to children. Should we put children in boxes and tell them, no, you can't play with that doll or play with that fire truck and take the toy away from them or something? No, of course not. Should we even tell our children how to dress if that's what they wanted to do? Like, no, you can wear pants, and if you want to wear pink, like, go for it. But telling children that they can pick their gender, and now I've heard that in public schools, like, kids are going crazy with these pronouns of like, you have to call me a cat now. Like, I'm literally a cat, and the teachers have to do it. Like, do you know how confusing this is for children? The thing is that a child, if they haven't even like started to hit puberty yet, they're not thinking about their gender like that much. You know, like little boys and little girls are just playing with each other. They're not thinking like you're a girl, I'm a boy, especially small children. And so as a like 5-year-old or a 7-year-old, because this is happening at the very small elementary school level, as a very small child to be told, do you want to be a girl when you're a boy? It's like a very strange concept for children. And then they're thinking like, well, do I? I mean, God made me this way. Like, should I do that? And yeah, I think it's super, super damaging. And then even going into the pubescent years, there's now this social contagion with switching genders. And it's insane to me that now as a 13-year-old, you can start being on hormone blocking therapy. That's like your choice now as a 13-year-old. You can't drink alcohol till you're 21 or vote till you're 18. But as a 13-year-old, in a crazy 13-year-old's brain who I knew myself when I was 13. I was psychotic. I was depressed. I was starting to experiment with drugs. I was rebelling. I was super emo and wore black, and I tried to do anything I could to piss my parents off. And also, I was confused about my sexuality. I hadn't fully discovered that I was bisexual yet, and I didn't know, am I a lesbian? Am I straight? Like, when you're in your preteen and going into your teenage years, it's a super confusing time. Like, you don't know. And there's this entire wave of detransitioners coming out now who said, I was literally 13 when I started taking hormones. They cut off my boobs when I was 16. And now I'm realizing, as I'm coming into my maturity and coming out of that insane fog that you're in these early teenage years of like, wow, I really just needed to accept myself as a woman, or I just needed to accept myself as a man. And it goes both ways, Now there's stories coming out of men who, they're 13, perhaps these people were gay or had trauma to work through, or maybe they just wanted to express feminine and didn't need to have their genitals mutilated. Now there's people coming out men who started taking the chemical castration pills that cut off the testosterone and taking the estrogen when they were 13, 14 years old. And now these people, because this wave is about to come, because it's been enough time now where this wave is about to come of detransitioning. And so now these people are 16, 18, 21, and they're saying, oh my God, what did I do? I'm not a woman. Now I have a micro penis, literally, that doesn't work. I have no sexual function, and I'll never have children. And this is all being put on them and starts in the public schooling system when we're telling our children, you can be a cat, you can be a woman, just literally take estrogen, cut your testosterone, have a micro penis, and get boob implants, and then you're a woman. It's like literally insane. So there's just so much, and there's something dark and evil that's going on there. I thought this was going to be a whole nother video, but I guess we're already going into it. Like, it's insane because Big Pharma makes $1.2 million off of each person who transitions. 1.2 million from each person. That seems like a really big incentive to push a wave of people who are wanting to transition, because Big Pharma has no soul and wants money, and 1.2 million per person is quite a lot of money. Just something to think on. But the moral of that story is a lot of this is starting in the public school system, with now teachers are having to misgender children and tell them that they can be cats, which is crazy. And also teens are just really susceptible. If you find a group of people that you really want to fit into, a lot of teens will just go with that. Like, oh my God, I finally feel accepted in this community, so I'm just going to go with it no matter what that means. Like, I'm sure we all remember from our teenage years, you can be really one-sided in the world. You can't really see beyond those few years. You think that that's just what it is. Like, I couldn't have imagined myself as a 31-year-old woman when I was 16 and how much I would have changed by now. So that's another reason why I don't want my children going to public school, because I don't want them being inundated with these really harmful ideologies that they could wake up one day as a 20-year-old and go, oh my God, I'll never have children. And I don't want to subject them to that as much as I possibly can. And the last point that I'll mention on homeschooling before wrapping this up is they don't really teach us curriculum that we use that much. It's crazy. I mean, maybe if you're going into like electrical engineering, all of this like algebra and this and that, and like memorizing the cities of every place in the world and all this useless information isn't helping us. Like, there's a reason they're not teaching us taxes, how to run a business, how to have emotional relationships with people. Oh my God. How to meditate, how to have an emotional relationship with ourselves, how to uncover our passions and to cultivate them. Like, there's so many parts of the human experience that we're not being taught, that we're just being left on our own about. And then we're being taught really not useful information that you just cram into your head, spit out, and then just forget about anyways. So I want to be able to control what kind of information and learning goes into my children's head. And I want it to be things that are going to empower them in this human experience and help them to be an entrepreneur and have their own ideas and opinions and really learn things that will help them in the future, not just stress them out and take away their whole childhood, forcing them to go to school for 8 hours a day like they're some kind of robot. That's no way for a child to live. Children are curious beings on their own. They want to learn on their own, and they don't need to be forced. Like, how miserable were you in your childhood going to school? Like, yes, there was beautiful moments in making friends, but for the most part, like, you're going to school kicking and screaming. Like, you do not want to be there. At least I didn't. I hated school. I mean, what child wants to sit in a classroom for 8 hours a day and be talked to? It's just not a natural way of learning, and it's miserable. And frankly, I don't want my children to be miserable. I want them to learn. I want them to grow. But I want them to choose in what way they want to do that and what subjects they want to learn, and help them pick things that are really good for their life and their emotions, and teach them how to be a better human and give them their childhood back. I think that we can do this. Thanks so much for listening. I just want to end on the note of, we do not have to keep following these prescribed ways of being, of going to doctors, of birthing on our backs, of sending our children off to these military-like institutions. We have a choice as human beings, and we can choose how we want to make the world a better place. And we do that by how we're going to raise our children, how we birth, and how we choose to show up in the world as parents. So I'd love everybody's feedback on this. Once again, final acknowledgement that I don't have kids yet. It's just something I've really been thinking into a lot, of how I do want this to go in my life ahead of time so I can be prepared. But for people who have homeschooled, who have thoughts on this, who have had their own birth stories, I'd really love to hear all opinions. I'm super open to all, and I super respect your decisions, because once again, I'm just here to support freedom. But sometimes we just don't know or don't think that we have these freedoms to make these different choices. So I'm just here to open a door for you, and you can totally choose which door you'd like to go down. Thank you so much for listening to this. It's really close to my heart. And I'll see you again very soon. Namaste.